Home remedies for polycystic ovary syndrome, PCOS. Polycystic ovary syndrome is a common condition related to a hormonal imbalance in women of reproductive age. It is characterized by high levels of androgens, male hormones, in the body. Researchers have also linked insulin to PCOS because many women with this condition also have too much insulin in their bodies. High levels of insulin cause the ovaries to produce more male hormones. Women with PCOS have also been found to have low-grade inflammation, contributing to insulin resistance. The exact cause of PCOS, however, is still unknown. Yet, genetics is considered an important factor as PCOS seems to run in families. It can cause symptoms like infrequent or prolonged menstrual periods, excessive facial and body hair growth, weight gain, acne, oily skin, thinning hair or male pattern baldness, and pelvic pain. The signs and symptoms tend to vary from one individual to another. This endocrine disorder is also associated with an increased risk for developing insulin resistance, type 2 diabetes, high blood pressure, high cholesterol and heart disease. Thus, early diagnosis of PCOS is extremely important. Although there is no cure for this problem yet, it can be controlled. Some simple natural remedies, medications and lifestyle changes can help manage the symptoms and reduce complications. Cinnamon. Researchers from Columbia University have found that cinnamon supplementation can help improve menstrual cyclicity in women with PCOS. Plus, a pilot study published in the journal Fertility and Sterility indicates that this herb can help reduce insulin resistance in women with PCOS. Add 1 teaspoon of cinnamon powder to a glass of hot water. Drink it daily for a few months or until you are satisfied with the results. Alternatively, you can take this herb in supplement form after consulting your doctor. It is usually suggested to take 1 capsule, 1000 milligrams, 3 times a day. You can also include this spice in your diet by sprinkling cinnamon powder on your cereal, oatmeal, yogurt, cottage cheese, peanut butter sandwich and on other foods. Flaxseed. Flaxseed can also be used to combat PCOS as it helps decrease androgen levels. It contains lignans that increase the production of sex hormone-binding globulin, SHBG, that binds testosterone in the blood, thereby preventing it from wreaking havoc in the body. Plus, being high in fiber, flaxseed helps slow down glucose metabolism and lower cholesterol levels. The omega-3 fatty acids in this superfood also reduce inflammation, lower blood pressure and reduce the risk of chronic diseases like heart disease. Mix 1 or 2 tablespoons of freshly ground flax seeds in a glass of water. Drink it daily for a few months or until you are satisfied with the results. Also include ground flax seeds in your diet regularly by adding it to your smoothies, soups and salads. Spearmint tea. Spearmint tea can also help deal with PCOS due to its anti-androgenic properties. A study published in the journal Phytotherapy Research found that drinking spearmint tea can help reduce hirsutism, or excess body hair, by reducing free and total testosterone levels and increasing luteinizing hormone, LH, and follicle-stimulating hormone, FSH, levels. Boil 1 cup of water in a pan. Add 1 teaspoon of dried spearmint leaves. Let it simmer for 5 to 10 minutes. Strain and drink this tea twice daily for a few weeks. Apple cider vinegar. Apple cider vinegar is also beneficial for dealing with PCOS because it helps control blood sugar and keeps your body from producing too much insulin. Less insulin means less testosterone. Plus, it will help you lose weight and improve your overall health. Mix 2 teaspoons of raw, unfiltered apple cider vinegar in a glass of water. Drink it daily in the morning and before meals. Continue for several weeks or until you see improvement. You can gradually increase the dosage of apple cider vinegar to up to 2 tablespoons per glass, 2 or 3 times a day. If the taste is too strong for you, mix the apple cider vinegar with orange or any other fruit juice. Fenugreek. Fenugreek promotes glucose metabolism in the body and improves insulin resistance. This in turn helps balance your hormones. It may also help lower cholesterol, aid weight loss and promote healthy heart functioning. Soak 3 teaspoons of fenugreek seeds in water for 6 to 8 hours. Take 1 teaspoon of the soaked seeds along with some honey in the morning on an empty stomach. Also take 1 teaspoon of the seeds about 10 minutes prior to lunch and 1 teaspoon prior to dinner. Continue this treatment daily for a few weeks or until you see improvement. You can also include fenugreek seeds and leaves in your regular diet. Saw palmetto. This herb acts as an anti-androgen, blocks 5-alpha reductase activity and reduces the conversion of the testosterone into a more active form called dihydrotestosterone, DHT. This in turn may help prevent hirsutism or excessive hairiness in women with PCOS. It also helps thinning hair grow back. Naturopaths often suggest this herb for the treatment of PCOS because it helps correct the hormonal imbalance. Take 320 mg of standardized saw palmetto extract daily for a few months. If you are taking a liquid extract, take 1 teaspoon per day. Chasteberry. Chasteberry, also called vitex, is another popular herb for relieving the symptoms of PCOS and treating infertility due to a hormonal imbalance. It is a great hormone balancing herb and is also used as a remedy for menstrual problems. Boil a cup of water and add 1 teaspoon of fresh or dried chasteberries. Let it steep for about 10 minutes. Strain and drink this tea daily for a few weeks or months, until you see improvement. Discontinue its use once you are satisfied with the results. Alternatively, you can take this herb in supplement form. For proper dosage and suitability, consult your doctor. Fish oil. Being loaded with omega-3 fatty acids, fish oil helps reduce androgen and improve insulin sensitivity. A study published in the American Journal of Clinical Nutrition indicates that omega-3 fatty acids can improve the symptoms of PCOS by balancing androgen levels. Plus, including fatty fish in your diet or taking fish oil supplements can help decrease inflammation, reduce body fat and fight against chronic diseases. There is no standard daily dosage for fish oil supplements. You can take 1 to 3 capsules 2 or 3 times a day or as suggested by your physician. Licorice. Italian researchers have found that licorice root can help reduce serum testosterone in women with PCOS. The researchers believe that the glycyrrhizin in this herb inhibits an enzyme that is required for testosterone production. Licorice can also be used as an adjuvant therapy for hirsutism. Plus, licorice root promotes ovulation and aids liver detoxification. The liver removes toxins and excess hormones and thus helps with hormonal balance. Add 1 teaspoon of dried licorice root to a cup of boiling water. Let it simmer for about 10 minutes and then strain it. Drink this tea 2 or 3 times daily for a few weeks. Alternatively, you can take this herb in supplement form. You can take 1/4 to 1/2 teaspoon of licorice tincture 2 or 3 times a day for a few weeks. Make sure to consult your doctor to find out the proper dosage for your case. Holy basil. Holy basil, also known as tulsi, can help reduce the symptoms of PCOS due to its anti-androgenic properties. It will help manage insulin levels and aid in weight loss. Basil is also an excellent stress reliever, and has antioxidant and anti-inflammatory benefits. Consume 8 to 12 holy basil leaves daily in the morning. Another option is to drink basil tea a few times daily or take this herb in supplement form. For proper dosage, consult your doctor.